Okay, so this is a seminar for mental health for children, and it's sponsored by the Fun Mothers Club as well as Dr. Egger. Um, we're in the middle of summer of 2021, and uh, we're going back to school real soon after a whole year of COVID-19, where a lot of kids didn't go to school. So it's been really hard. And that's why we need Dr. Egger to talk to us about um, mental health for kids and how we can prepare them to go back to school. And I'm going to let Dr. Egger talk about her experience and what she's been doing.
Great. Well, thank you. Thanks so much for having me. I'm Dr. Helen Egger. I'm a child psychiatrist, and I am also the co-founder of Little Otter, which is a digital early childhood mental health company. So we care for the mental health of kids who are 0 to 12 years old and their families. And I co-founded the company with Rebecca Egger, who is my daughter. So it's an amazing experience to be able to build this company with my daughter. And we launched in California on May 4th and are caring for families. And we can talk about the kind of care that we provide. And we are going to be launching a free back to school mental health toolkit, which people will be able to download or check out on our website. And it has an assessment that parents can fill out, and then we will provide you with personalized insights about how to get prepared for this school year, and really to focus on 4 areas: child mental health, parent mental health, which is so important for child mental health, family stress. And, we have all been through so much stress in these last 18 months. And then lastly, some issues that are specific to the start of school. And I really appreciate being invited here today to talk about whatever folks want to talk about. I mean, I'd be happy to answer questions. And take guidance that way, or just to talk about some of the things that we think at Little Otter are going to be really important for families as we make this transition.
I know in the past we have had other seminars where it's just been really quiet and we just want to hear information. So if you could, and then people would jump in when they need to too. So
Great.
Yeah.
Okay. Yeah. So, well, I think the sort of frame before we jump into the question of the transition to school is really recognizing the impact of the COVID pandemic and all of the stresses related to that, and how that's impacted families, and particularly how it's impacted children and moms. So from the perspective of kids, their lives have really been interrupted, with school happening at home, not being able to see friends, not be able to participate in activities. I know for myself, so I'm a mom of 4 children who are, older, but my youngest are twins, and they were in the spring of their first semester of college when COVID hit. And so, of course, they came home. And it has, really been challenging for them. They've done a great job, but how to really continue to develop and grow when this thing that you've been so looking forward to, college, just got totally disrupted. And that's true for children who would have started kindergarten, or children in middle school or high school. So, when we think now about this new year, we have to realize that it's going to be new in a way, to so many kids. And that's assuming and praying that everyone gets to go back to school and kids have the opportunity to go back to in-person school. So that's one issue, just realizing that this has been very stressful and kids have missed out on some of the learning opportunities, not just academic, but the social opportunities to learn and to grow. The next thing is that this has been so stressful for moms and dads. And, I just have so much appreciation for families who have school age or younger children, how to manage when you don't have childcare, when school is on Zoom and is some at in person, some in Zoom, and how you're supposed to keep going and doing your own work. And at the same time that you're basically now in the role of being a teacher and a childcare provider and a activity maker. And that not only, has sort of disrupted the normal patterns, but it's just really wearing as a stress on parents. And I'd love to, if there are folks on the call who want to just share about sort of the place that they are right now as we're looking toward the school year, because it's important to realize that we all have been really and continue to be in a very stressful situation, and that is going to have an impact on all of us.
I
So I
can
don't know.
go.
Yeah.
So I have two girls. They are 10 and 12, and so they were in fourth and sixth grade.
Yeah.
And the little one did not go to school at all last year, but the
Mm,
older one, she was able to go for a couple months at the end and a few weeks here and there starting November because she goes to a private school.
mm-hmm.
So thankfully, my little one has been really self-sufficient and she can manage on her own. So for
Mm-hmm.
me, I I can't say that I was too stressed. I mean
Okay.
I did work and I was working from home, but it was stressful to see that they weren't able to do what they wanted to do, what
Mm-hmm.
were their norm, go to school, see their friends, and
Mm-hmm.
learn in a classroom setting. And
Right.
well, it was hard for the older one because she started a new school, so that was really stressful for her to
Mm-hmm.
try to
Mm-hmm.
navigate her way around meeting people, meeting teachers in a computer, which she's not,
Right. Right.
right? So
Right.
that was my situation, and hopefully this new school year means that both of them will go to school. That's what the public school has been telling us.
Right. Right.
They're going to start school, so we're going to see what happens. So the public school starts on the 18th in
Mm-hmm.
a couple
Mm-hmm.
weeks. Yeah, and then my the private school starts another week after that.
After that, so what are you noticing? And obviously, it may be different for each of your children in how they're feeling about the start of school.
So the little one's really excited because
Yeah.
she wants to see her friends. The
Uh-huh.
older one, she's 12 years old. So I
Mm-hmm.
think with the preteen, puberty, and
Yeah.
school, I don't know how much it is, COVID stress or just, I know that she's excited to see her friends, but then she's not excited to start school, which is, that's just a normal thing, I think.
Well, yeah, and I think one thing about what you're saying is it's very understandable that children and families can have mixed feelings, right? You can
Right.
feel excited at the same time that you feel anxious or worried about some aspects. So it's not that you just have one feeling or another. I do think though that it's important for us to sort of listen to what our kids are saying, particularly about the areas that they're worried about or concerned about. Um, One, because I think children, when they express feelings, it's really important for us to take children's feelings seriously
Mhm.
and to ask them about it. And because sometimes we can assume as grown-ups that we know what the thing is that's making them worried, but
Yeah.
it may be something really different that your child is thinking about. So one thing I would really encourage is to be able to have open conversations, both about being excited, but also about, some of the worries or concerns, because then one, you're opening up the opportunity to talk about it. And particularly, as you said, with your daughter just sort of entering into her teenage years, you want to really keep those avenues of communication open.
Yeah.
And this is a, particularly good time to be able to do that. I think one thing I want to say is that it's very understandable as parents that we want to jump in and say, oh no, it's going to be okay, provide reassurance, or try to find a solution for our child. And one thing I would really encourage, again, is to be sort of open and accepting of what your child is telling you, and not sort of jump in to figure out what the solution is or try to move past what those emotions are.
Okay.
Yeah.
Definitely.
Yeah. So
I know some of the other moms, they probably have had more challenging year than I did.
yeah.
So they wanted to share.
Yeah, I'd love to. I mean, I think that obviously every family situation is unique. We all have faced different challenges. So it can be really useful to talk about, things that have happened with your kids or things that you're thinking about and maybe are worried about.
Darnie has her hand up. You're welcome to speak, Darnie.
Thank you, Funny, and hi, Helen.
Hello.
So last year, my son did TK, and that was entirely online.
Okay.
I did not think of it as an effective means at all, but I had to swallow my beliefs and just encourage him on the surface level to kind of be involved. But for him, that particular teacher was really, really good, and she tried her best. But given this year, I think he got used to the fact that school is going to be online, and on and off we had, it was really hard because young kids, they don't sit in one place, and
right.
Why do I have to do this? I'm done with school. And I would have conversations with the teacher, and she would be like, okay, if he were in the class, this is what I would have done. If he were in the class, but I'm the mom, and suddenly I'm his teacher.
Right.
I think my biggest problem last year was suddenly just those 2 to 3 hours, I would constantly just lose it because push my buttons, and I knew he was kind of doing it, and I really had to. I think it was a lot more about how I was handling the situation too, and not just about how my child was. But eventually it helped. But we are trying to talk to him about, what, August 18th is the first day of school, and you are going to go in person.
So is he going to be starting kindergarten this year, or is he still doing another year of pre-K?
No, he was in TK last year, which is transitional kindergarten. So he does kindergarten in August.
Okay.
And so right now he's just brushing it off. I don't think he's really getting the gravity of it. For now that he will actually go 5 times a week, 3 hours.
And how do you think he's going to manage the separation? You're mentioning, going every day and being at school.
I have a feeling it will take time for him to realize that. It will also be his teachers. Last year when I spoke to his teachers, they did say that we are expecting children to need more support this year because of the separation part. It's been a year of school. But if there is anything we can talk to the child about, like I'm using basic language, you're starting school, you'll go in person. But beyond that, I think my challenge is going to be where he says, I'm done, I'm not going. Or what, every day?
Yeah.
That
Well, I think what you're describing, I mean, I think really Zoom school for preschoolers or, go kindergartners is just so challenging, right? I mean, so much developmentally what young children are learning at that stage. It's not like sitting in front of a desk or a computer. They're learning by playing and interacting with other kids and be able to sit in circle time. And so we, obviously we were in dire circumstances, but you're absolutely right. This year was no substitute for being with other children. And so I do think you're being very sensitive in realizing this is going to be a really different thing for him, right? Now, I know you have confidence that he can do it, and recognizing that it is really it's like a completely new thing, right?
Yeah.
Going to school. And so the first thing is that even under non-stressful circumstances, when kids, particularly starting in kindergarten or when they start middle school, or we expect to see kids do what we call regressing. And what that means is that the child, for example, may have been going to sleep without trouble, or not having tantrums, or all these different things that you think like, oh, they've developed these skills. What we often see when children are stressed is that they kind of go back to an earlier stage. And that can be, it's like, why are you acting like a baby? No, you know how to do this. But what's really important to realize is that it's really because they're being stressed that these are new skills that kids are learning, right? And so when they're stressed, these new skills maybe aren't working as well. The other thing to anticipate is that it's so common for kids to do great during the day at school, right? And come home and fall apart. And you'd be like, wait, you call the teacher and you find out, and they're like, no, it was going great. He had a lovely day. And what I want people to take away from this is that is a good thing. What that shows is that your child in the setting outside of the home.
My internet. I'm sorry.
Can you hear me?
I can hear you.
Can you hear me? Is it me or?
Darnie, can you hear? She seems to be frozen right now.
Yeah. Okay. Well, we can wait till see if she comes back. Or I could just finish the answer and she could watch it.
So, yes.
Yes, it is. Well, what I was going to say is that when kids do well during the day at school, and then when they come home, they, sort of, I call it letting your hair down and maybe, cry or have tantrums or things like that. It really is a reflection of how much work it takes for a young child to be able to do these new things in school and behave appropriately and follow directions. And so I think it's important to anticipate as a parent that your child's going to need some more comfort and support and understanding, really, that that it's hard to be in school, and when they feel safe when they come home to kind of let down their guard a bit. Now, most of the time for kids, after a few weeks, maybe a month, kids really settle into this new situation of going to school. And the thing that we talk about at Little Otter, and one of the things with our back to school toolkit that we'll be able to give parents some of the tools to assess is, when should you worry about either your child's fears, maybe separation anxiety, sort of having negative feelings about school? When do you sort of wonder, is this just the natural part of beginning school? and when is it maybe a sign that there's something clinically significant going on that we could seek help for. And oh, hi, DK, are you back? Oh,
yes, sorry.
Hey, hello. I was just giving the answer and just saying that it's very expected that kids can do well in school and then kind of fall apart when they come home. And you can anticipate as a parent, I mean, you talked about understandably how it would push your buttons and just kind of so hard during this year where you had to do this, you know, working and taking care of the house and being the teacher and being everything in this situation. But what I would recommend is really anticipate that your child is going to have, it's going to be hard, this transition, not terribly hard, but to sort of understand when you come home that he's going to need a little bit more support. He's going to need understanding. And what, you know, it's because he feels comfortable at home that he might be able to show these feelings. And so just a little more cuddling, a little more understanding, making sure that, you know, he's getting enough sleep and other things like that are really gonna, you know, make a difference in the transition. And this question that I was saying, and this isn't just true for younger kids, when do we sort of say, this isn't just a typical transition. This is something that maybe I should be worried about. Maybe there's something more going on. And the real thing to look at is if your child is having a lot of fears or negativity or separation issues that extend beyond sort of the first month of school, and just seem to, your child just doesn't seem to be acclimating and adapting, that can be a sign that maybe something else is going on, or maybe that you could use some help and support from either a parenting specialist, like which we have a Little Otter, or even, you know, a child therapist. And so, you know, it's really, and it's also if when you talk to the teacher that your child is still feeling anxious and afraid when they're at school, right? So we look at whether the child's feelings or anxious feelings or negative feelings are happening at home and at school, are happening with you, with the parents, and with other grown-ups, and that it's sort of lasting and not getting better. One last thing I'd say is I think you can, in preparing your son for this transition, is, you know, if you can visit the school ahead of time, if they can meet the teacher ahead of time, even just to go play on the playground, you know, just so, because it's unfamiliar, right? Or if they're kids, if you know some of the other kids in the class, whether you can get the kids together. The other thing you can do is just have some special way of saying goodbye to each other. That's kind of almost like a little secret just between you when you say goodbye. I mean, it could be, you know, a big hug and say, see you later, alligator, or, I mean, it can be silly or funny, but again, something that really sort of marks, you know, saying, okay, bye-bye, and then we're going to see you. And you want to be matter of fact, but, you know, that can be a kind of a special extra dose of love that your child can count on if you do it the same way every day before school starts.
So I have a question. Let me know.
Yeah.
This is not the forum for it. But,
okay.
Let me assume, I'm not trying to be negative, but I'm just trying to be realistic with expectation. Yeah. So let's assume he's okay at school, but then at home we see these things. So we recently moved. So off late, suddenly he says, I don't want to be alone. Just be with me all the time. So things like that, something that clinginess, like don't leave me alone in this room. So I tried to think about it. I said, you were fine before. What are you scared? He said, I'm scared. I said, of what? And then he thought about it. He wasn't sure of what. So when it comes to things like these, let's say he has this minor thing where he's acting up, and I'm trying to understand, does a parent have to dig deeper or just let it go?
Well, so that's a really good question. And I think it's got different layers. I think the first layer is children often can't tell you why they're feeling some way. They're feeling it. Now, if we think about ourselves,
right.
I know thinking of myself, there are times that I might feel sad or worried, and I'm not exactly sure. You know how you can feel kind of stressed out and you're not quite sure what it's coming from. But particularly young children, they don't really have the language yet in a lot of ways, or to be able to tell you why. So I think sometimes why questions aren't as helpful, because so some ways that if a child says, you know, I don't leave me alone, I feel scared, some ways of just being with saying, oh, so sounds like you're feeling scared when I leave the room. I mean, just sort of reflecting back and just sort of listening and sort of not taking the lead. Sometimes also even children can sometimes tell us about what they're feeling inside through their play, that maybe you'll notice in some of his imaginary play that there may be some themes about separation. But, you know, I think that it's also, you know, I don't know whether your child's sort of separation issues are, you know, just an experience he's going through. But I do want to tell you that children can experience significant anxiety. And one of the ways that children have, you know, anxiety that can really impact them and their family is something called separation anxiety. So when kids have separation anxiety, they don't want to be alone in a room. They want to follow you around the house. They may get up at night just even to check that you're okay. They might get very, very upset and worried that something bad is going to happen to you when you leave. And so there's a whole sort of constellation of other expressions of this anxiety, and kids with this can find it very hard to separate to go to school. So, you know, I obviously I don't know the situation, but I would say just to think about noticing if this is a pattern and whether it's lasting a long time. We're going to give some information about how to get to our website for Little Otter, and we've got awesome resources, like really, so you could just look up and look around separation anxiety and anxiety in kids, just to see, and I'm not saying that this is a problem that needs, you know, outside attention for your son, but I think what I always want parents to do is to be able to put themselves in their child's shoes and sort of try to see through the eyes of your child, and just take seriously that even if it seems like, well, you didn't used to have this problem and now you're having it,
right,
it's a real experience for your child, and you want to take it seriously. But one more thing I'll say about anxiety, though, is it's such a natural feeling to try to help our children avoid that feeling, because you can tell that it's an uncomfortable feeling.
Yeah.
But avoidance does not help anxiety. So avoidance makes it worse, because if you are like, oh, I'm scared to go to school maybe, or something like that, and if you're like, okay, I'll let you stay home, then you're giving the message, yeah, that is really scary and I need to protect you from that. So that there are ways, and again, we have information on our website about it, but it's a challenge. You have to take baby steps with a child who's feeling anxious, but the real important thing is to learn ways to help your child be brave, help your child boss back anxious feelings, and then, find we can't make anxiety go away. That's not our job, but we can give our children tools to manage those feelings and be able to do the things that they need to do.
I think what I don't want to do is hurt him by saying, hey, you're fine, just stop.
Yeah, that I don't think that's very helpful. Although sometimes, it's like,
I can be very snappy like that sometimes when he really sits on my head. And that's the thing. So when I asked him a lot of questions today, I was hoping that I'm not giving him the words. So that fine line between trying to be helpful versus, I don't know how.
And here's what I would encourage. Think about it less about being helpful to like give him solutions, and be more receptive and supportive and listening. And not trying to jump in to solve it, because that also can give the message, no, don't have bad feelings, don't have negative feelings. It's because it's okay. We all feel anxious at times, or afraid, or angry, or sad. So I think it's important that we're just not always jumping in either to reassure or to solve, because really we want to teach our children the skills to be able to solve things for themselves, right? That's what sort of the job of growing up is. So, and one of the skills that we learn is how to manage big emotions, how to, when we have big emotions, not to have to sort of act in a certain way that's harmful.
Right. Okay.
Yeah.
It's really helpful.
Yeah. Yeah, absolutely. Yeah. Is there anything else that folks want to talk about or bring up?
Gita mentioned on the chat that she has a younger one from 3 to 4 in pandemic, similar to Dharani, where he's expressing himself by acting up, and then he's also a clingy. So you've touched upon a lot of things, but this is her child is a little younger. So
yeah, so here's something that is a really important thing to understand about younger kids. I mean, this is really kids 2 to 6 years old, that when children are acting up, and I'll just give an example of having temper tantrums, or being oppositional in their behavior, or irritable, that is, we think of that as kind of acting up, as bad behavior. But in a lot of ways, it's the way that young children act when they're having either anxiety or fear or other kinds of, as I said, big emotions. So I'll give you an example. So I'm a child psychiatrist, but I'm also been a researcher in the area of early childhood mental health. Before I founded Little Otter, I was in academic medicine. So I was head of child psychiatry at Duke University, and then I was chair of psychiatry at NYU in New York City. So I've had the opportunity both to do a lot of clinical work, but also sort of research in this area. And one of the areas I've done a lot of research on are temper tantrums, because to me, it's super interesting. Like, okay, we know little kids, preschoolers have temper tantrums. Any parent has experienced this, right? But the question is, when should we worry about temper tantrums? When are they just typical behavior, and when might they be a sign of something else going on? So it turns out, if kids during temper tantrums are hitting, biting, kicking, or breaking something, so basically during a tantrum being aggressive in some kind of way, then kids who are having those kind of tantrums are actually at increased risk of having some kind of mental health challenge. And I like to call these kind of tantrums, I call them a mental health fever for little kids. Just like a fever, if your child has a fever, you don't know, is it a virus? Is it a bacteria? You don't know what the cause is, but it's a sign that maybe your child isn't well and you need to do something. And so it's sort of the same when kids are acting up in this kind of tantruming or aggressive kind of way. And so the fact of a child sort of acting up and being clingy makes sense to me, because that can be one of the ways that a child who's feeling anxiety or feeling some kind of insecurity or big feelings sometimes is just going to express it in kind of a behavioral outburst or oppositionality, but then at other times might express it in terms of being fearful or clingy. So, but I'd love to, if you can tell me any more details, I could be more helpful specifically.
I think it's not been like, I think you're fortunate that it hasn't been like hitting any other kids.
Yeah.
Going in that line, but it's mostly like really screaming really loudly. And I think I've heard that. I don't get the complaints from the teacher, so it's mostly when he's at home.
Yeah.
That's this really wide range of and very big emotions all the time. So he does go to school. He goes for a few hours every day. And yeah, we've never experienced any like sort of negative feedback from school, but I mean, we kind of see that it's always like really, really loud, like lots of noise and lots of screaming, lots of
lots of big emotions.
Yeah, I don't know, maybe he's just expressing himself, but it's just, I guess all of us being cooped up at home, it's also harder.
Well, it's even, I think that makes a lot of sense. And so, and I think it's the combination of wondering, is this sort of screaming out of distress or being loud, or is it just, oh my God, get me out of these four walls with these same people in my family who, we're just all on top of each other and we're getting on each other's nerves. So I think it's, and that's, hey, sweetie, how are you? So, I think it's, and I think the other thing that I sort of recommend for parents is sort of like being an emotion detective with your kids. Like, do you notice any pattern, right? Are these sort of episodes of big feelings, are they when your child's tired or hungry? Some kids have a really hard time with transitions, right? Like for going to bed or for turning off the TV or something like that. And so, the more that you can kind of observe when these things are happening and maybe think about what was happening right beforehand, that you can start sort of getting a handle on how to support your child in those moments and sort of anticipate when these challenges might be coming up.
That sounds really helpful.
Yeah. And we talk about something called, it's sort of called priming, but one thing that kids often do have a hard time with is transitions. And so the degree to which we can sort of give a signal ahead of time. So let's say your child is watching TV or something like that. And it's, instead of just being, turn it off, now we're done. And say, okay, in 5 minutes, we're going to turn the TV off, but then have something in your mind for when it's turned off that, oh, now we can go to the park, or, oh, it's bedtime. Now we can go read a story. So, because children, we should always appreciate how distraction can sometimes really help when a child is sort of going into the tunnel of having a fit, is that sometimes you can just, oh, remember that? Oh, that cool book we read, let's go find that, or something like that. And it just, because sometimes it's better for us not to just sort of go down that vortex with them.
Sorry.
No problem. Yeah, it's So anyway, so I think it's sort of a combination of giving kids sort of the heads up that when transitions are coming, and you can never underestimate the importance of kind of structure and rituals. Like, I don't know if there are any people on the call today who have any troubles with bedtime. That's totally common. And how helpful it can be, one, to give your kid, you know, a warning, like, oh, in 5 minutes, we're going to start getting ready for bed. But then to have a very a ritual of how you do it that helps your child transition from the busyness and activity of the day to being able to get quieted down. Think of it as a process. And so, you know, it starts with brushing your teeth, but then going to bed, doing some reading and snuggling with your child at that time. So, you know, I think it's always important to remember that the big job of these early childhood years is to learn the skills of being able to manage these big emotions, to learn the skills of being able to transition from one activity to another or from school to home. And that the fact that they're learning is means that it's not, you know, sometimes it doesn't go so well. And that's often just because the skills are still developing. Let me see, I have to put my glasses on.
She says, how can one balance between establishing rules
Yeah.
and pushing back versus letting them make their own decisions and getting creative?
Yeah, so I think what's important is I think it's very important to give children choices, because that's how they're going to learn to make choices, but that it's within a safe structure. One thing I'll always remember that one of my supervisors when I was in training in child psychiatry said that when children push back, either because they don't like something you said or something you asked them to do, they need to know, not in a rigid authoritarian way, but they need to know that they have the security of you sort of being that container for them. And what he said was, if you pushed against a wall, let's say you were like in a room, in a space, you pushed against the wall and the wall fell down and you just sort of saw space around you, you'd be very scared. So it's important with kids, and it's always a balancing thing, but is realizing that you want to give kids choices and things, but it's within the structure of, you know, not like we're the parents in an authoritarian way, but we're here, we are the parents, and we're here to take care of you. And, you know, and also I think one way to do it is just don't sweat the small stuff, right? I mean, you know, if it's like, no, I want to wear my blue shoes, not my red shoes, you know, it's like, that's fine. Put the red shoes on. You know, that is not a hill you want to die on, right? But to save when you, you know, to be very clear about those structures and boundaries when they're the things that matter a lot more than that.
Sounds great.
Yeah.
Can you tell a little bit about Little Otter? And
Yeah.
you mentioned a few things before, but it'd be great to hear more.
Yeah, so Little Otter, as I said, we're a all digital, meaning telepsychiatry company for caring for kids 0 to 12 years old and their families. And what's really different about Little Otter is we're not there sort of like a traditional mental health provider to just focus just on your child. We know that kids' emotional health and behavioral health is really connected to the whole family. So when a family comes to Little Otter, we really have the whole family join and want to assess how each of the kids in your family are doing and how you are doing as a parent. What's your stress level? How are you managing? And so you come and we have assessments that will give us a sense of what's going on. And then you do what we call a welcome call with one of our wonderful, wonderful providers to hear what are the issues that are happening. And what we are providing at Little Otter is the full spectrum of care. From, we have amazing parenting specialists who can work with parents on some of these kind of daily typical issues, managing tantrums, managing bedtime, eating issues, some kinds of aggression and other things like that. Really things that aren't a mental health problem, but are really issues that we can teach parents skills to make life go a lot better in families and to really reduce conflict and stress. Then when we identify for a child that there is some kind of mental health challenge going on, we have amazing, wonderful therapists who are trained in caring for kids 0 to 12 years old. It really is a mental health specialty. It's not the same as taking care of grown-ups, and it's not the same as taking care of teenagers. So all of our providers are trained in how to care for young children and their families. In situations where it's warranted, we have child psychiatry in case there's needs for medicine or other medical things. And then lastly, we also do couples counseling or marriage counseling, because we know that when there's conflict or tension in the relationship between partners, it can be very difficult for them to get aligned in how they're going to support their child or how they're going to work together as parents. The other thing that's different about Little Otter is that we have a sort of the team of providers works together to support your family. So, you know, nowadays, like if you were seeing a marriage counselor or your child needed some therapy or something, they're all separate people and they're not talking to each other. But at Little Otter, we really we don't just provide the care and meet you where you are, but that we will do the work of sort of integrating that care, also talking to your pediatrician or the teacher, or if your child is having speech therapy or occupational therapy or any of those other things. We need to really bring together all of the people that are caring for your child and making sure that everyone's on the same page. And one of the things about Little Otter is obviously I'm bringing my expertise as a child psychiatrist and a researcher in this area, but I'm also really have built our care model at Little Otter out of my experience as a mom. And as I mentioned, I have 4 children. My oldest daughter we co-founded Little Otter together. Then I have a son who's 4 years younger than she is. And then we decided to have a 3rd child, and I have identical twin boys who are our 3rd child. But my middle boy, Sasha, who's now 26, but when he was 13, he became ill with a very serious illness that's an autoimmune illness that presents with mental health symptoms, but it's called autoimmune encephalitis. But the importance of my experience is I've really walked the journey that so many other parents have of being a mom, and my husband also, parents with a medically ill child, and how it feels we've gotten great care, but we had to fight for it. And really that's from my experience as a mom. There are 2 things that have come out of my experience with my son. One is that because I was a doctor and I was, an attending at Duke, I could get the care my child needed. And because I knew the people to call. But so many, I mean, so many families aren't able to do that because they just don't have that information or those relationships. So, you know, what I really came out of and what really is why we founded Little Otter is that I want families to get access to high quality care, to know that if they come to Little Otter, they're going to get the highest quality of care that they could find anywhere. But the other piece really from my experience with Sasha is so often in medical or lots of situations, people don't treat parents like they're the experts of their kids. They act like they have all the answers. And so at Little Otter, we always say, parents are the experts about their kids. And our job at Little Otter is to be a partner with parents, right? We're definitely bringing our expertise, but that we really have to work side by side with parents to figure things out and to understand what's best for your child. And that's sort of a different kind of approach that I'm really hoping sets Little Otter apart, so that when families come to us for care, they know that we value them, that we believe that parents are the experts, that there is no shame in having challenges as a family or for your kids, because these are common problems, and that we can really help. So that's what we built. So I saw the question about insurance. So right now, Little Otter is out of network for insurance, but we do provide, either we provide what are called super bills, so you can get reimbursement. If you have insurance that has out of network benefits, we will actually file the paperwork for you so that you can get that kind of reimbursement. You know, eventually we may be able to be working, and we're talking to work with insurance companies. One of the reasons that we decided to go directly to families rather than through the insurance companies is that we're trying to create a opportunity for a different kind of care than is commonly available right now.
Thanks, Geeta. I had that question too.
Yeah, of course. No, it's very important. But here's the sad fact around a lot of our mental health system in this country is that it's really broken. And the problem is that a lot of the providers, it's almost impossible in a lot of situations to be able to even find a provider that connected with your insurance. And, you know, the average wait to be able to see a child psychiatrist now is, if you can find somebody who has an opening, is about 4 months. So it's, and this is why at Little Otter, we also really are tracking all of our outcomes and how we're helping families, because that's how we're going to make the case that this is a kind of care that should be supported by insurance.
Yeah. Geeta, then the question, are all the interactions digital?
Yes, so we are 100% digital company, and that really comes out of the fact that it is so hard. One, there are many places that don't have child mental health care. The other piece is that it really provides a level of convenience and engagement for families. I don't know about the rest of you, but again, I have being a mom of 4 kids. Okay, you have to leave work, you have to take your kid out of school, you go to the appointment, you know, and it's so, and what if you have other kids, and it's very, very stressful. And so this means that we come to you in your home. The other thing that's different is we have a whole messaging platform so that you can send messages to your providers 24/7, you know, and so it's not sort of like, oh, see you next week. Good luck. Hope things go well. We really are there to support our families in the day to day, because that, I mean, the truth is that you're the ones living 24/7 in your family with your kids, and that issues are going to come up, and we feel it's really important to be able to reach out and get support then, rather than having to sort of store it up and wait for a whole week. So you know, there are, you know, there are some challenges that don't work with digital. So like if we had a child who was psychotic or something like that, that wouldn't be a good fit. We also do not do primary assessments for autism, and there are a lot of great places that do that. We do think that we are going to be a great resource for families whose kids have autism for a lot of the associated issues, because actually about 40% of kids with autism have ADHD, and about 40% have an anxiety disorder. So we are really looking forward to working with families whose kids have developmental delays or developmental or intellectual disabilities to be able to help with a lot of those common challenges like tantrums and anxiety and oppositional behavior and other things like that. So yeah, that
sounds great.
Yeah, and we provided I think we have resources that you can send out with our website. And as I said, we have awesome resources on our website, and you know, I think anybody would find them beneficial. Also, you know, we'd love to have you check us out and see if we can help you. And we'll also, we'll send further information, but just look out on our website. We're going to be releasing on, I think it's August 17th, our back to school toolkit. And as I said, 100% free. It has a science-based assessment that I developed and wrote. And based on what we learn from the answers that you give to questions, we have some really good insights and activities you can do with your kids. So we're really excited to offer this to all families.
Great. I'll be sure to let all our members know, as well as our
great.
We're
also on the 26th, and we'll send this, we're going to be having a free webinar that it's going to be me and our head of parent coaching, Jasmine, who's fantastic. And so we'll be talking more about a lot of these back to school issues, and we'll be recording that also, so it will be available on our website.
Great. Yeah, looking forward to that. That was something that I was going to ask, if you have parenting guidance or seminars like that.
Yeah, so we'd love to have you join us for that. It's going to be, we're excited to be able to offer that.
Great. Yeah, we'll definitely share that with all of our members.
Great. Well, this has really been fantastic. Thank you so much for having me. And please know that if we can be helpful in any other way, either to individual families, or if you want to do some other seminar at another session like this, we would be delighted to do that.
Thank you so much, Dr. Helen.
Yes, yeah, you can just call me Helen, it's fine.
Okay.
Yes, absolutely. Well,
really, your comments, really appreciate it.
Oh, good. Well, thank you. I really am grateful for the opportunity, and I'll look forward to coming back and meeting with you all at another point.
Thank you.
All right. Bye-bye. Have a good evening.
Bye-bye.
Bye.